Hello and welcome to Chapter 5. I hope you guys are doing well. We're going to be doing a small slideshow and hitting some high points on this chapter. We're going to be talking about sepsis, combination coding, multiple coding, and HIV. So without further ado, let's get to our slideshow. So Chapter 5, specific guidelines, chapters 1 through 10 in your ICD-10 manual. So let's talk about combination coding. In this chapter, there are many instances of multiple coding and combination coding. Let's talk about a couple of key terms that are very important for you to know. Combination coding is when one code fully describes the condition. Multiple coding is when it takes more than one code to fully describe the condition, circumstances, or manifestation, and then sequencing of multiple codes is considered. For example, conditions and common symptoms or manifestations. Let's look at E10.21, that is type 1 diabetes mellitus with diabetic neuropathy. So that is an example of a combination code. I-25.110, atherosclerotic heart disease of native coronary artery with unstable angina pectoris. K50.112, Crohn's disease of large intestine with intestinal obstruction. So those are just a couple of examples of some combination codes. Okay, multiple coding is acceptable when it takes more than one code to fully describe the conditions or the condition. So let's talk about resistant to antibiotics. For example, multi-drug resistance, Mycobacterium tuberculosis. The exceptions are methicillin resistance, MRSA, and Staphylococcus aureus, MSSA. Your first listed diagnosis is always going to be your infection. And then it's going to be followed by the Z code, Z16, because that's your drug resistant code. So you're always going to code your infection first. Then you need a second code to say that they are resistant to antibiotics. So that's an example of multiple coding. It takes two codes to fully describe what you're talking about or what you're coding. So let's take another example of a combination code or multiple coding. It's combined spinal cord degeneration due to pernicious anemia. So your first code that you're going to start with is your anemia code. Then you're going to go to pernicious, and that is D5110. Your second code is going to be what is happening because of that specific anemia, which is going to be degeneration combined with anemia. So that's G32.0. So that is another, I think, a more simplified example of multiple coding. Now we're going to talk about sepsis. It's very important to know the correct definitions of septic terms since they are so close in nature. For example, septicemia is an infection in the blood. Septic shock is when the infection is so bad, the circulatory system starts to shut down. And there's SIRS. It's an inflammatory condition associated with sepsis. Please pay special attention in your textbooks on page 96 through 99. This is the guidelines for sepsis. And then you need to label in your ICD-10 where the different levels of sepsis are found. Please make notes, highlight, and just keep some special notes tucked away for whenever you're actually coding sepsis so that you can be sure that you're using the specific codes you need. So let's talk about TOOLBOX 5.1. Robert has sepsis resulting from a post-procedural infection that is now complicating his care. So it's an infection he got after a procedure. So number 1 says sepsis resulting from a post-procedural infection is considered a complication. If the documentation stated that Robert's sepsis was severe, would you reference what reference would you reference for the subcategory for code assignment? And I'm going to give you the ICD-10 code, and I want you to go to your manual, and I want you to read this code. The code is R65.2. When reporting severe sepsis, you should also report what dysfunction, and that's going to be organ dysfunction. You have to tell the whole story of that sepsis. So the next subject we're going to hit is HIV B20, which is the basic HIV code. You never code HIV unless you have a confirmed case, because once you code HIV in a patient's health record, it stays forever. So you can only code confirmed cases. So B20 reports HIV infection and includes AIDS. Positive serology or culture but no symptoms, you should report Z21, which is asymptomatic HIV status. HIV exposure but no positive serology report is Z20.6, contact exposure to HIV. Then you have R75, which is inconclusive serology, and it's used for newborns of AIDS mothers. I'm going to push this point again. Only confirmed cases of HIV infectious illness should be coded because the diagnosis stays in the patient's record forever. So only confirmed cases can be coded. You can use for B20. You can use these other codes for other stages or other reports or definite symptoms. So I've added a case study. I would like for you to read this case study. So pause and read the case study. At the bottom, you have a diagnosis, discharge diagnosis, and it has uncontrolled pain, secondary to widely metastatic breast carcinoma, dehydration, type 2 diabetes mellitus, uncontrolled. So remember, your first listed diagnosis is going to be, why is the patient here? So this is going to be your assignment for this little Zoom video. You were to answer 6 through 7. I know the number 6 is left out, but I need you to upload the answers for me. But I'm also going to include the answers to this case study. Please use your integrity. Do not just write down the answers, but I want you to have it to be able to correct yourself if you need to. So here is your answer key. I hope you guys have a great day. I know this was a short Zoom. Have a meeting today, so I won't be with you live, but I hope you learned something and you have a great day. Let me know if I can do anything to assist. Bye-bye.